Welcome to Web Microbiology, a podcast for Bio 204 at Allegheny College of Maryland. I'm Professor Kelly. Let's get started. Episode 9, ELISA and Rapid Testing. So far, we've talked about phenotypical methods of bacterial ID, but these are limited. Biochemical testing is ineffective for viruses, and in some cases, organisms must be identified at the genetic level to distinguish closely related species or strains. In this episode, we will begin exploring modern methods of microbial identification, beginning with immunological techniques such as ELISA and rapid antigen testing. Immunologic tests take advantage of the binding between antigens and antibodies. Antigens are molecules associated with pathogens. Antibodies are proteins capable of recognizing those exact molecules. This interaction is a fundamental part of the adaptive immune response. We'll talk more about this in Chapter 17, but basically, when the body encounters a pathogen, the immune system produces antibodies that can bind to the pathogen's proteins. And that helps to neutralize the invader or to mark it for destruction by other immune cells. Because these antigen-antibody interactions are very, very specific, lab tests can use them to detect the presence of a pathogen, or identify microbial products, or determine whether a patient has been previously exposed to a particular infectious agent. One important immunological method is ELISA, and that stands for Enzyme-Linked Immunosorbent Assay. Although several ELISA formats exist, the central idea is the same. Antigen-antibody interactions are linked to an enzyme reaction that produces a detectable signal, usually in the form of a color change. ELISA can be used to detect antigens from pathogens, antibodies produced by patients, or other biologically important molecules. Because the assay amplifies the signal through enzyme activity, it can be highly sensitive. Sensitive tests have very few false negative errors, meaning they nearly always identify positive results. Now, there are a few different types of ELISA, each designed for a specific purpose. In a direct ELISA test, an enzyme-linked antibody binds directly to an antigen of interest. These are more common in research labs versus clinical settings, so let's focus on those clinical tests. An indirect ELISA is used to detect antibodies in a patient's serum. That's the liquid portion of blood. In this test, known antigens are attached to a well plate, and any matching antibodies present in the patient's blood sample bind to them. Then we add a second enzyme-linked antibody for the sole purpose of generating a color change. The approach is commonly used to determine whether a patient has been exposed to a pathogen, but it can't reliably tell if that patient has an active infection or not. Indirect ELISA tests look for serum antibodies, immune molecules produced by the host. Now, in contrast, a sandwich ELISA can be used to detect antigens. The target molecule is sandwiched between two antibodies, one that captures the antigen and another that detects it. Because two separate antibody binding events are required, this method is both highly specific and sensitive. In other words, it's really good at detecting positive results with a low chance of error. Sandwich ELISA tests look for parts of the pathogen itself, so these tests can indicate active infections. Now, rapid diagnostic tests apply very similar principles. Many of those use antibody-based detection systems designed to produce visible results within minutes. And when I say rapid diagnostic tests, a lot of times I'm talking about the tests that you add some kind of liquid to and you see color-changing lines. So examples include rapid strep tests, pregnancy tests, influenza tests, and many COVID-19 antigen tests. One major advantage of these methods is speed. Results are available during the patient visit rather than days later. So this faster diagnosis can improve the treatment decisions and also infection control measures. But rapid tests also have limitations. sensitivity is lower than molecular methods, that means that false negatives can occur, especially when antigen levels are low. False positives may occasionally happen because of cross-reactivity or technical issues. So rapid tests must be interpreted within the larger clinical context, taking into account all of the other information. Immunological tests also do not provide information about antibiotic susceptibility. So while identifying a pathogen is valuable, clinicians still need additional testing to determine which antimicrobial therapy will be the most effective. Now, despite all these limitations, the immunologic methods have transformed diagnostic microbiology. They create a bridge between these traditional culture methods and more advanced molecular techniques. They're fast, they're practical, widely used, as you should be very familiar with in healthcare setting. In our lab activities, you're going to explore ELISA testing in a virtual lab closer to the end of the semester. But understanding how these tests work help explain both their strengths and their limitations. Now, in the final episode for Chapter 18, we're going to close the loop on diagnostics, covering PCR and more modern molecular identification. I'll see you then.